Hello, my name is Dr. Kent Eichenauer, and along with Dr. Glenn Feltz, we co-created the Psychosocial Risk Factor Survey, also known as the PRFS. The Psychosocial Risk Factor Survey is an assessment tool that can be used with a variety of medical populations to measure a number of different psychological risk factors that we know that can impact our health. And the psychological risk factors that the PRFS measures are depression, anxiety, anger and hostility, social isolation, and also another scale called emotional guardedness. The next video that you're about to view is Dr. Feltz demonstrating how the PRFS is scored once the patient has taken this test. We hope that you enjoy it.
Hi, I'm Dr. Glenn Feltz, and as Dr. Eichenauer mentioned, I'm going to be showing you how to score the PRFS. So let's get started. First, you look to make sure that the patient has completed the items on both sides of the form, and then to start scoring, what you want to do is to run a pen through the bottom here to open this up. And I've already done this. In fact, you'll see that this is entirely scored for demonstration purposes. But you run your pen through the bottom to open this up, and you come to the scoring page right here. And what you want to be able to do at this point is, again, check to make sure that the answers that the patient has done have transposed themselves to this page. And you'll see that these are marked from the patient's answering. Then take a look at item 12. You'll see that it's highlighted here. This is an item that is specifically mentioned regarding the person's feelings or thoughts about whether they want to end their life anytime soon. A person who scores either a 4 or a 3 on this item is indicating that they've had some thoughts about wishing that they could end their life or wishing that they were dead. So when you see a score of 4 or 3 on this item, you want to make sure that you have some sort of process intact so that you can respond to this patient's concerns even before you get to this point. Make sure that you have some way of getting to the patient to address those concerns that they have about suicidal thinking. All right. Then check down the column here, which you see that we have circles on this side, squares on this side. As you want to go down this column, you want to make sure that you record the score that they've noted here into the circle on the middle of the page. So you go down each one. This is a 4. You see it comes into a 4 recorded here. Down here we've got a 3 that gets recorded in here as a 3. So you basically just fill all those circles in with whatever score they have over here. You do the same thing then over on this side with any of the squares. Here they've noted a score of 4 on item 37. That comes over here in the depression scale as a score of 4. You'll notice on some of the items that there are more than one answer, and it's a circle or a square in some of these items. Make sure that you do record both the circle response as well as the square response in that item. Those will be added to the total score. After you've recorded all the scores on the middle of the page, then what you want to do is total down the column for each construct. So for the depression score, you're going to add all of these scores to get a total down here, and you can see it's already scored. We have a total of 35. For anxiety, you total all these scores and you get a total here of 30 for this particular patient. You do that for all the items until you have all the scores down here recorded. And then it's really simple after that. It's nice and convenient. As you flip this over, you can transfer these scores from the scoring page to the profile form. The depression score is going to go down there. Anxiety score will go here. Hostility score will come down here. Social isolation, record that down there. And emotional guardedness, you want to record that here. That takes you to the profile page. Now for this, the next part of the process is to come up to this scale and circle the number that corresponds with their total score. You do that for each scale, and you can see I've already done that here. So you have all the scales recorded with the correct score. And then if you wanted to, you could connect those to give yourself a nice visual profile for the patient. But what's more important is to look at where these scores fall in the profile form. Here we have some ranges of severity for their scores, as well as we have a percentile rank that helps you judge where their scores are compared to other people, and a T-score, which is more of a statistical measure that helps you to also compare this person's results with the general population. So in this case, we note that the person had a depression score of 35. That places the person at a T-score of 64, an approximate percentile rank of about 93 or 94, and it puts them in the moderate range of severity. For anxiety, their score of 30 correlates with a T-score of 58, a percentile rank of about 83, and it puts them in the mild range. It's helpful to look at these scores in that way so that when you sit to talk with the patient, then you can show them where their scores fall and how it relates to this level of severity for them. It gives them a nice visual reminder of sort of what your concerns can be for them. It's also helpful to look at a total score, which is the sum of all these scores, and I haven't done that for this one, but this is more of a, the total score is more of a research scale, but it is also useful to look at their score over the course of time, however it might change in the total score. It's sort of a common distress or generalized distress scale, and it can also be helpful for comparing patients within your program. Make sure that you have the demographic information completed up here, and then also what's really handy is that down here you have some more descriptive categories of whether this patient's test at this administration was a pre or a post test, whether they're a cardiac patient or a pulmonary patient, their gender, any diagnoses that you think are significant to their rehab, as well as their age, their facility, and the date that they came into your program. You'll notice also that there's about a third of the page left blank down here. This is for notes that you can make as you're talking with the patient, or perhaps in preparation for your talk with the patient, where you can just record things that maybe come out of your discussion or concerns that you want to follow up on. And that's about it when it comes to scoring the PRFS. As you can see, it's a pretty simple process. It takes about 5 minutes once you get used to it and you get sort of a little more experience doing several of them. And you'll see that it's a very useful tool. There are other videos that I hope you will take a chance to see that will show how to interpret these results for your patients, as well as how to administer the PRFS to people. So thank you for your time.